Hello everyone. If you're dealing with dizziness, imbalance, or vertigo, or if you know someone dealing with these symptoms, then you might be thinking, what do I do next? Who can actually help me with this? For an unfortunately high number of people, this can be a longer and trickier journey than it ever needs to be. On average, it can take about 6 months to get a dizziness diagnosis. But right off the bat, there is help out there. For instance, my name is Anthony Veglia. I'm a doctor of physical therapy who specializes in vestibular rehabilitation, and I'm an ambassador for VITA, the Vestibular Disorders Association. For a short and sweet answer, check out the Find a Clinician link at VITA's website, vestibular.org. There, you can punch in your zip code and you will find any and all VITA members nearby who can be a great start to get some help. Ideally, dizziness should be diagnosed and treated with a whole team backing you up, a multidisciplinary approach, because there's no one vestibular specialty in healthcare. It's an area that's covered by multiple types of providers. For example, I work at Scottsdale Ear, Nose, and Throat. There we have 2 otolaryngologists, or ENTs, who will be your first stop for an initial visit and a potential diagnosis, then with some very specialized equipment, testing from a vestibular doctor of audiology to determine many things about the health of the ears and brain towards your balance and orientation. And lastly, you'll come hang out with me, a physical therapist for treatment with vestibular rehabilitation. Depending on the cause, you may need to visit a neurologist more than an ENT. But this diagnosis should ultimately come from a physician, ideally one of those 2 specialists. Now, for your rehabilitation, you'll want a physical therapist who has experience specifically in treating patients with vestibular disorders. Have they taken multiple and varied courses in this area, more than just like a one-time Saturday? Are they involved in vestibular organizations? Do they have the letters NCS after their name? That's a neurologic specialist certification. It's a very meaningful title. It's really hard to get one, and it covers vestibular diagnoses and a lot more in great detail. For vestibular disorders, you also really want your PT visits to be one-on-one. Many outpatient PT clinics have multiple patients per PT, which is fine for many orthopedic issues, but this really requires a different type of care. One of the easiest ways to find out if they can help you with these issues, ask them what percentage of their patients are there for dizziness, imbalance, and vertigo, and what diagnoses. If they see a patient with positional vertigo once or twice a week, managing your complex vestibular migraine might not be their area. If it's 40 hours a week and covering nearly all vestibular disorders like myself and others, you're probably going to be in pretty good hands for these issues. Don't settle for a PT who can't answer those kinds of questions. Dizziness is already such a battle at times to get testing, get a diagnosis, and receive treatment. So find someone who has the experience, the training, and the confidence to get you stable. To summarize, check out VITA's big list of vestibular clinicians, visit your doctor, particularly an ENT and/or neurologist, get testing with vestibular specific equipment, and then get training from a physical therapist who knows these vestibular disorders well, not just BPPV. That is one of the most straightforward diagnoses, but the diagnosis and treatment for it has almost no overlap with the rest of dizziness or imbalance treatments. There are providers out there who can help you, so please use the many resources at VITA at vestibular.org. And if you're in Arizona, maybe I'll be able to treat you myself. If you want more education from me, you can watch Dizzy Therapy on YouTube for diagnoses and concepts about how these ears work, or how they're supposed to work. And God bless you on your return to stability.